Dear President Juan Miguel, dear Shockwave families, buenos dias. My name is Carsten Knobloch. I am the Vice President of the ISMST and the General Secretary of the German DGEST. And I will talk on shockwaves in high-level athletes. First things first, I'm very sorry that I'm not in Elche in person, because both my beloved wife Caroline and little Thaddeus felt severely ill yesterday with excessive vomiting, high fever, and diarrhea. And therefore, I cannot make it in person, unfortunately, to Elche. These are my conflict of interests. So to win the Champions League, like Real Madrid did on June 1st, or the Spanish team, as you saw on the first slide on the Soccer World Cup, it is very important to have players without injuries. And the term is called player availability, the chance for a trainer to make strategic decisions based on a healthy team. There are 10 years old data showing from the Champions League that one day off in the Champions League costs some 20,000 euro. And there are real-world data from the UEFA Champions League study published in the British Journal of Sports Medicine showing that, for example, patella tendinopathy or Achilles tendinopathy cause a mean time loss of 18 days. Multiplied by 20,000 euro, you can see a significant amount of money. So especially in high-level professional athletes, time might be really money. As in high-level athletes, another aspect is a needle-free sport, because there are doping regulations in action, and oftentimes the athletes prefer non-injective approaches. So question is how to accelerate healing. The idea is to best heal even faster, like this gentleman. So if you have or consider a toolbox with your different therapeutic options, you might end up with the left one side or with the right one side. And you can imagine that with the right one, very extensive armamentarium, you might tailor your therapy much more in detail and individualized than with the left-hand side. And my friend Ludger Gerdesmeyer, who's just about to travel to Kona, Hawaii, competing on the World Ironman Championship next week, coined the term soft tissue engineering, where he thought of combining shock waves, EMTT, also magnetic fields, laser therapy, vibration, and injections. And at the German foot meeting in Vienna in May 24, where I met Vinci Auersbeck, which you know, Karin, Juan, and Wolfi, for sure. I introduced the concept of the regenerative clockwork, where I added precision and coordination in this concept, where we combine, for example, focused and radial pressure waves, oscillating magnetic fields like PEMF or EMTT, maybe even the combination of both, low-level laser therapies with different wavelengths, different injection therapies, PRP, maybe hyaluronic acid, my collagen or exosomes, and, for example, in tendons, for sure, eccentric training, load optimization, kinesiotaping, and so on. If it comes to shockwave in sports medicine, we have a profound number of studies on positive effects of shockwaves in tendons and shockwaves in bones. Bone issues in sports are mainly stress reactions or in far rare non-healing situations. We have stimulating, encouraging data in muscles, and we have much less in the moment data on the positive effects or any potential effects of shockwaves on ligaments. Very nice overview has just been published before Sylvester last year in the British Journal by Adam Temforde, where you have a nice overview over the applications for shockwaves in athletes. If it comes to ISMST, we have standard applications, as you know, which are usually chronic tendinopathies of the shoulder, the elbow, patella Achilles tendinopathy, and plantar fasciitis, as well as stress fractures and OD, which are all relevant in sports. And if it comes, and I touched briefly in tendons, to tendinopathies, we differentiate not only an intrinsic compartment with the tenocytes, but also an extrinsic compartment with immune system, the vascular system, and the nerve system. And it's known that a myriad of different changes are seen in tendinopathies in histology. We are acknowledging fiber cramping, apoptosis, adipocyte accumulation, hypervascularization, hyperinnervation or neo-innervation, and hypercellularity. So there are different things. And with the help of high-resolution ultrasound, we now can see much more detail of the vascular architecture of an inflamed tendon. This is a mid-portion Achilles tendinopathy with a 24 megahertz Canon probe in my office, and you see an enlargement of the tendon to 12 millimeters, and the neovascularization arising from subcutaneously and distributing within the tendon. And this is seen on the long axis or even on the short axis, so you get a very good topographically idea of where the vessels are entering the tendon, which then help me in my, say, minimal invasive injection therapies to guide my injections based on these neovascularizations. We can furthermore assess elasticity using shear wave elastography. So we have not only grayscale ultrasound with the diameter, we have Doppler techniques for the assessment of the inflammation, and we have elasticity measurement with shear wave. So we have three very potent parameters to describe a tendon with ultrasound. There are numerous even overview and meta-analysis data showing that shockwaves are very good on tendons on the lower limb, as you see in the Kourakakis work published in the British Journal. And if it comes to neovascularization, our friends from Italy have shown beautifully that when using, for example, an electrohydraulic device, HMT, you see before the neovascularization, and over the course of 5 sessions in 3 months' time, we see a reduction of the neovascularization and clinical, an improvement in the VISA-R score, which is the relevant patient-related outcome measure in Achilles tendinopathy. Our friend Amos Saxena from Palo Alto, California, has shown beautifully that even the combination of radial pressure waves and focused shock waves is better than radial or focused alone in Achilles tendinopathy. And it's work in progress, not published yet. I'm playing around with shear wave elastography, and you see that one session of focused and radial pressure wave in combination could significantly reduce elasticity in a inflamed Achilles tendon from 26 to 10 kilopascal, which is a very significant and immediate reaction. You can see even the reduction of the inflammation by the special ultrasound, which is Doppler modes, which is called superb microvascular imaging. And you see before and after, for example, in epicondylitis, a significant reduction of the neovascularization with combined shockwave. And for example, in Osgood-Schlatter disease of the adolescents, where I usually never ever do any injections, I combine or might combine in severe cases different therapeutic options in the regenerative clockwork idea with radial and focused shockwave, laser therapy, as you see, and even electromagnetic transduction therapy to reduce inflammation and to improve the return to sport in these Osgood-Schlatter patients. And you see, this is an adult Osgood-Schlatter with very severe 31-year-old gentleman with very severe neovascularization around his tuberositas tibiae, where I combined focused and radial shockwave, EMTT, laser therapy, and because he's 31-year-old, sclerosing injection therapy. And you can see a significant reduction of the neovascularization from 25 to 5%. In bone marrow edema, say stress edema, it is a very good tool in athletes as well, as shown in this meta-analysis from Hamburg, Germany. In symphysitis, osteitis pubis, in a soccer adolescents cohort, shockwaves could significantly improve the return to play in contrast to a wait-and-see policy and physiotherapy. Unpublished yet, but shown on the ISMST meeting in 2018 in Auckland in metatarsal 5 fractures in soccer players in Japan, Jones fractures. The shockwave application after surgery at day 1, 3, and 5 could significantly improve and accelerate the return to play. Open phases, open is always remains an issue, but you see in this 11-year-old hockey girl with a 2-year history of ankle pain, applied focus shockwave with MRI before and after, and you see within 5 months a reduction of the bone edema and no premature closure of the epiphysis. And this holds true, which I published with Wolfi, who is in the audience as well. Hi, Wolfi. Servus. Where I combined for the first time electromagnetic and electrohydraulic in a young 14-year-old parkouring athlete with these avulsion fracture on his calcaneus, where I could achieve bone healing within 6 weeks, where I combined in 3 sessions focused electromagnetic shockwave, EMTT, and focused electrohydraulic shockwave in order to improve the possibility of bone healing and to reduce the need for non-weight bearing in this patient. In muscle injuries, we showed in experimental data that the microcirculation of the muscle is improved with the help of shock waves. Angela Zisler from Salzburg has shown that the satellite cells can be stimulated, published in the American Journal of Sports Medicine, by shock waves quite tremendously. And it seems that not only modulation of inflammation, but also antifibrotic effects might play a role in substantial structural muscle injuries. There are real-world data from German Bundesliga published with the radial device by Christoph Schmitz and co-workers, showing that in contrast to standard therapy with different Müller-Wohlfahrt type of muscle injuries, 1A, 2B, 3A, there could be a significant improvement in return to play by up to 54% in contrast to standard treatment with the help of even radial pressure waves. This is a young tennis player with a rectus abdominis tear in his belly, where you see in elastography significant changes in his left abdominis muscle, where I applied focus shockwave and EMTT and could reduce stiffness and improve elasticity immediately after 1 session by 37% and after 1 week by 47%. So there are immediate changes even on these not so often seen sport injuries. In meniscal tears, this is an image with a 33 megahertz linear probe with a medial meniscus tear. I applied in a 41-year-old gentleman 3 sessions of focus shockwave and EMTT, and you see 3 months later, I do some stress testing on the medial meniscus. You see still the hypoechogenic structure inside. However, it seems that both sides, superior and inferior to the hypoechogenic region, are moving in line, and the same holds true after 6 months, where I did the same testing. As you can see here nicely, the medial meniscus still, but only rarely visible, the hypoechogenic region, and elastography showed a better elasticity in the injured than in the non-injured contralateral side. And he was able to run 3 times 10 kilometers in a week, pain-free, without clocking and nothing. So this was the first, let's say, image to show that maybe even in advanced ages like 41, there might be some kind of healing with less scar, even on the poorly vascularized meniscus. which has just been republished or supported by a study with MRI, published on July 8th this year by the Japanese group, where you can see that shockwaves could significantly improve the T2 relaxation time in MRI. In ligaments, I want to highlight one study published by Patrick Weniger from Vienna, who applied focus shockwave at weeks 4, 5, and 6 after ACL reconstruction and could significantly improve visual analog scale, EKDC, and the Lysholm score. As you can see, even if we, in my view, rather late applied shockwaves in the course of the ACL. So in my view, it might be even better to apply shockwaves after ACL injury immediately in the first week. And I myself had a knee luxation, and I applied on the second day after operation the shockwave in order to improve my ligament fixation, as well as to reduce my bone edema of my tibia head. Last topic to cover is concussion, which play a major role in collision sports like American football, ice hockey, or even in soccer. This is the quarterback of the Miami Dolphins, who is off for repetitive severe concussion and is now thinking on maybe potentially ending his career because of this, because not only of the immediate effects, but also of the long-term sequelae, because there's a entity called chronic traumatic encephalopathy, which is the structural damage of the brain after repetitive concussions. And these histological changes seen in chronic traumatic encephalopathy are the very same like in Alzheimer's disease. And even in concussion, in soccer, concussion plays a role. And there's a nice New England Journal paper from the Scottish Soccer League showing that for field players, the Alzheimer hazard ratio is 5 times higher, for Parkinson's, also a neurodegenerative disease, 2 times higher. And for the goalkeepers who usually do much less heading, they have a significantly reduced risk for dementia. And if you look in the UEFA Champions League study, the mean time loss for concussion is 9 days. There further is a perspective that if you suffered a concussion, you end up with a higher risk for musculoskeletal injuries like ACL injury or ankle sprains, about 2 times higher after your concussion, because obviously if the brain is somehow impaired, the musculoskeletal response might be different, and this might explain the higher frequency of injuries. And that might be the place for TPS, Neuralit, in concussion. I will later in my AI talk dive a bit deeper in this topic. So, Juan Miguel, El Presidente, dear ladies and gentlemen, thank you again for your attention. And again, sorry for not being with you. Have a great meeting. Yours, Carsten.